I just wanted to talk a little bit about virtual hand therapy or distance healing. I'll be honest with you. Maybe a little more than 2 years ago, I heard the concept and thought, there's no way. I mean, it's woohoo and waste of time or, yeah, whatever. But the universe kind of pushed me in a direction within my career to learn this work. I'm going to be honest with you, it has not been an easy journey from a medical profession perspective. I have taken a lot of flack. I have had a lot of criticism and a lot of concern. People thinking, why on earth would you be going down this road? Well, I trust my gut. I trust my research and I trust people. If I feel that somebody has a valid contribution to make to my learning journey, I'm going to give them a chance. And I really felt that way about Kimberly. And I have to say that over the last 18 months of knowing her and working with her and learning from her, it has been an evolving journey that has just been so exciting for me. It has given me a new lease on life in my practice, a little spring in my step, and most importantly, it's given me the most unique skill to help people. We have treated dozens of patients in our hand clinic, and every single patient has come away with an improvement. I use this work in my practice now. I don't remember how to be a hand therapist without it. That's the honest truth. I just am drawn to the physics because chemistry and invasive procedures, particularly cortisone injections, don't even get me started on those, are not designed to heal us. They're designed to keep us in a system that keeps us a patient. Whereas with this work, I aim to heal my patients within 1 to 3 sessions. That's what I want to do. And I'm doing that. I healed a trigger finger this week in 2 appointments, obviously dependent on how long it's been there, etc. So what does it involve? It involves biofield tuning using physics, which is a carrier wave in the form of a spectrochrome laser and a tuning fork and a pendulum. Those are the tools that you need to work with a person. I do use crystals and stones and rocks as a hologram and my pendulum. And when I tune my mind into my patient, I'm able to depict on that hologram exactly where their deficits are and where their energy blocks are and their physical damage to the tissue is. I then work with Kimberly's principles and how she's taught me to do this work. I then reassess with the pendulum, check in with the patient. Patients will feel what you're doing. They will feel tingling. They will feel sparks of electricity, shooting pain. They will feel a lightness. They will feel an emotional release. And they will have pain relief. So that's the amazing thing about what you can do. And then as a hand therapist, you can add on and demonstrate kinesiotape, demonstrate your exercises and all the rest of it. But I just feel this is a crucial step in our career towards offering patients something more on a virtual Zoom session than education and exercises. We have to be teaching people about their bodies, about their emotions, about how things have impacted them in the past, and how they can be empowered to take control of their pain and their situation. I've had some very moving experiences within my practice, and there've been 1 or 2 cases where I really didn't think that I could make a difference. And the one is a patient I'm currently treating this week who's had cerebral palsy from birth, and she's got a spastic hemiplegia. So very severe increased tone in her right upper limb. And she hasn't been able to take her hand and move her wrist for the whole 18 years of her life. She's had like really, really tight flexors. She hasn't been able to open her fingers. And with a biofield session, I was able to achieve that for her in an hour. And her mom is really hoping she'll be my YouTube success story. But to see the joy on her face when she can actually open her fingers and use her fingers to grasp and to move her wrist, I just think there's something there's something that's been missing in our profession. We have missed the biofield. We have not known about the biofield. We've gone straight onto the human body. And in doing that, we haven't opened the patient's opportunities to achieve great things. The other condition I can think of is 3 different types of radial nerve palsy, one from surgery, one from a Saturday night palsy, and one from a virus. And in all those cases, traditionally, I would have told them, you have got to wait a month to 3 years for recovery, and I'm achieving full recovery in 2 weeks. So there's so many cases. I've healed a fractured hand of one of my patient sisters who was, a 4.5-hour drive from me. Virtually, we were able to heal that fracture much faster. So within 10 days versus, waiting 5 to 6 weeks. So I really believe that this is the new frontier in hand therapy. I am very passionate about pioneering this. I know that there's been raised eyebrows in my community and from my colleagues, but it's okay because I am absolutely convinced from the work that I've done that this is the right path. This is what we've been missing. We have to offer our patients something different. We have to be able to do the real, true, holistic assessment of our patients, to really understand them and to understand what manifests and why it manifests. There's some moments in my practice that are so moving and emotional that both the patient and I can choke back the tears because of the revelations and the ability to assess things. So if you would like to learn more, you don't have to be a medical professional. You can be a biofield tuner, you can be a healer in any shape or form, you can be a teacher, you can be a mom. If you want to learn how to do this work, it's open to you. If you would like to receive distance healing or experience it in the practice, if you're in Johannesburg or Mississippi near Kim, then we're really open to doing that. I am very grateful to Kimberly's genius, her genius in developing the spectrochrome laser and then learning from the best energy healers in the world and then to be able to share that with me. I've got a long way to go. Each patient is my teacher. I'm learning, and I'm even learning on myself. So yeah, I invite you because this is truly amazing.